Beverly and Barbara, people driving down 17 here in Isle of Wight County are passing by this billboard in support of Riverside Smithfield Hospital. And you know who else is driving by it? Ambulances also going down 17 to the James River Bridge because they got to take patients into Newport News in some cases because there's no hospital in the county. This is what the future Riverside Smithfield Hospital could one day look like in Isle of Wight County. Right now, there is not a hospital in the county, which people here say is sorely needed.
It will allow us to help this medically underserved area.
Bill Downey is the CEO of Riverside Health System. The company wants to build a hospital in the county. Riverside says about 2,000 people have written letters in support, and today the Department of Health held a virtual public hearing on the proposal. There's also a billboard along Route 17 in support of the hospital.
The approval of this project, we believe, will be beneficial to this fast-growing area.
The hospital would have 50 beds, including 10 ICU beds, and would be built in the Ben's Church area of Smithfield. Right now, the chief of Isle of Wight Fire Rescue, Patrick Humphrey, says they have to take hospital patients to Suffolk or Newport News, which sometimes can take about an hour. Crossing the James River Bridge leaves the possibility of a bridge lift.
It's going to also mean that the citizens will be able to get care quicker, but also that our units won't be tied up on calls, that they'll be able to get back in service in the county for the next incident.
And during the public hearing, people told at times emotional stories about their fears of needing emergency care. Kim Liebold is a nurse practitioner at Riverside and Newport News, but lives in Isle of Wight County. She recalled having an issue giving birth and needing to go to a hospital, but she had to go to Newport News.
Praying that I would survive and he would survive because I felt no movement until I got a mile outside of Riverside. So that was 40 minutes of thinking that my child or I would not survive.
Luckily, she and her son made it to the hospital in time.
Having the ability to have a labor and delivery in our own community as a young parent, you shouldn't have to worry about, something that's so beautiful.
And the Department of Health is going to take all of this feedback, and staff will make a recommendation, and then the Commissioner of Health is expected to decide whether or not to approve the hospital in December. Live in Isle of Wight County, Brendan Ponton, News 3.